Hey there, welcome to Talk to Me Tuesday on a Tuesday from 3 to 4. I'm your host, Maddie B, and today I have two special guests with me in honor of the Final Four. We're still doing a sports session here. So this is sports therapy. I have two doctors here that specialize in sports therapy. Is that right? Wow, so we've been just sportsing it up for the last month as well as just a little bit of April. So we're going to talk a little bit to you guys about sports therapy, physical therapy, and we're really going to focus on the spine as well as extremities, right? So that way you guys get to learn, and I'm going to be your guinea pig today. I'm a little nervous, but it's going to be okay. So just let's introduce them. Let's meet them a little bit more about them. So Dr. Tony Tran is here with us from Integrative Spine and Sports. So introduce yourself and tell them a little bit more about yourself, where you come from and your experience.
We're on Facebook, right?
Yeah.
I want to get those waves coming. Who's waving?
Those likes.
Everybody waving?
The likes.
Well, I'm Tony Tran. I'm a chiropractor here. This is my partner, Jung. I guess to begin with, I graduated in 2010. Started doing a lot of sports therapy. Became known for that. 2014, opened up my business along with my partner here. And we started treating in a lot of different gyms, such as this Self-Nine Innovations, and we grew our practice. And now we have 3 clinics, and we're getting people better. And you'll be seeing a little bit of that here a little bit with Marty. So if you have any questions at all, make sure y'all ask today. If you have any pain, injuries, anything like that, make sure y'all speak up. Because we get calls all day about that.
Yes.
And it's free today.
Yes.
Less money is charging.
Yes,
Charging.
We want to open up the lines of communication for you guys to ask these doctors here that you have them for this designated hour. They're very busy. They can tell you themselves. Ask away. Ask any questions, any pains that you guys might have had from sports, from even sleeping wrong, anything. Let them know that's what they're here for. I also want to introduce Dr. Jung that's here. So introduce yourself, where you come from, what's your background story?
So I am Dr. Jung. I am originally from 713 Houston, Texas.
Hey,
I attended the University of Texas at Austin, 2002. That's how I met
This guy.
my guy.
Okay.
My chiropractor twin. We met back in 2002, so we've been best friends.
Rocking since.
Yeah, and then I attended chiropractic college. I graduated 2014, and then after that, partnered up with the man in Houston. The sportsman is a guru in Houston. And then, it's just been a blessing having, especially Dr. Tran, to pretty much impart his knowledge about the sports medicine, because I didn't know that coming out of school. And then just having the blessing to treat these athletes and rappers and whatnot.
Right.
Everything's come back in the nice way. So, and obviously, like I said, our main mission, our main premise here is to get people better.
Get people better.
Because I really hate to see people in pain, like really. And then for our treatment method, I mean, it's part of them. Like, to see somebody come and walk in with horrible, they can't even walk crying, and then you walk out with a smile on their face.
That's awesome.
Tran could not ask for anything better. So.
That's awesome. So a lot of what you guys are hearing today is a lot of the things that we've talked about from the show is that we're very interested in you guys. So getting you better, making sure that you have great representation, either D. Miller and Associates or Integrative Spine and Sports. So they're here to help you guys. And as you guys just mentioned, look at this wall of fame. So talk to me a little bit about this wall of fame. I don't know if you guys can see. Let me move my hair out the way.
Yeah,
but there's just a lot of athletes here. You also mentioned rappers that you guys have here from Houston, Texas. So talk a little bit about that. They have trusted and put their lives in your hands. So these are a lot of awesome people that are in the league. So that's awesome. Talk a little bit about that.
Well, first of all these guys on the wall did sign waiver forms to get the information released. Nobody dropping anybody. It's okay. All right.
Disclaimer.
This is a law firm now. We're very HIPAA compliant. We're
we're not HIPAA compliant.
But we like I said, we've been blessed in the sports medicine world. We've, started with athletes. I have to give a shout out to James Hedebo. He was my first NFL guy I've met.
Big up to James.
He used to fly out in Detroit to get him treated and stuff like that. Still a great friend of mine right now. And then just from him, the word was passing along to other athletes about how we're getting them better. And, we're able to get referrals. And now today we have a nice little niche of players that we treat. So.
That's awesome. So I tell you guys all the time, but I really have great people on the show that you guys are really in good hands. Truly, truly. These two doctors here, Dr. Tony Tran, Dr. Stephen Jung, great hands, and you're going to see right now, but this wall also tells you guys that a lot of these athletes trust them. They fly down. They don't reside here. They fly down to make sure that they're in good hands as far as the sports therapy, and we're going to talk a little bit more about that. So today I think we want to focus a little bit more, and you guys tell me, you guys are the professional, a little bit more on the spine, but then at the end we're going to talk about all these little limbs that make a big difference as well. So let's start a little bit with the neck. So what causes some of the neck pain? Like, I know last week we talked about how important it is to do certain exercises and how it's important to do it right, because some of these exercises cause neck pain or even like a whiplash. I know I've danced. Most of you guys know I'm a dancer. So with that hair whip that we do, could that affect the neck?
Well, pain in general can be caused by several different factors. Be caused by your mechanics, the type of job that you have, or you're at the computer. Depends if it's sports related, then you're doing stuff over and over and over again. So there's a lot of wear and tear in the body. Trauma as well. If you fell down, hit your head on the ground. If you've been in a car accident, if you slipped and fell somewhere, if you maybe turned the steering wheel wrong way or stepped the wrong way, you're gonna get a lot of bundling of tissues around those joints and stuff like that. And especially with trauma, if you have a trauma that will throw the spine out of alignment, and then you're gonna have issues along the spine. It could be nerve issues, or it just could be the muscle tightness around that area too as well. So it could be caused by anything.
Wow, you hit home. Like, a lot of you guys can probably say, yes, I slept wrong. Yes, sports. A lot of those things, even whiplash, or maybe if it was like you slipped and fell wrong, all those things you kind of hit home on what could cause pain. And even being at your desk, just being in that position.
Or even,
mostly at that.
Or even looking down at your phone all day. We spend how many hours on our phones looking down at this?
So right now, as you're watching the show, make sure you put your phone up and look at it like this. Don't look at it like this. That's a good point.
Because you got to take into account there's so many tiny neck muscles that connect our head to the top of our skull. And with you looking down at your phone all the time, that's more weight bearing on top of your skull than whereas your skull weighs up to 10-15 pounds. Oh. So that's added on more weight already.
So when they tell you have a big head, you really do. It weighs 10 to 15 pounds. That's crazy. So you just mentioned a little bit about the muscles around on the neck. Does it also affect like the shoulders, the arm, or is that just something that we just think that it's also affecting it?
Well, everything has to be in balance, right? Everything in life has to be in balance. Now, your spine has to be in balance. So, the vertebrae is like the building blocks of the spine. So if there's things that are tugging it to go forward to the side, or if it's rotated a certain way, it's going to cause the spine to get out of alignment. Therefore, it's going to cause a lot of forward posture motions and things like that. So there are different type of bones and type of muscles that connect everything together. So you will see a lot of neck issues associated with shoulder issues. So it's rare that we see somebody that doesn't have mid back pain or upper back pain that doesn't have neck pain. It's always connected at some point.
Pretty much every left shoulder can affect the right ankle. The whole body works in that whole connected chain.
Okay. That makes a lot of sense, because sometimes we don't notice when something is hurt or how much we need it until it's hurt, and you're like, oh my God. When you have a crick in your neck, oh my gosh, you can't really move the whole side of your body. So is there any other things that trigger the neck pain, since we're talking about neck right now, that you guys might want to add before getting
you mentioned crick, right? So people are like, I got a crick in my neck. I don't know how it happened. I just woke up with it. Well, there's signs that tell you that something's going on, like tightness, okay? So tightness is a symptom of some type of injury that's occurring, but people don't realize that. They think it's normal. Then I said, well, have you been tight in your neck for the past couple months? Oh, yeah, it has. I was like, well, why are you surprised that you got a crick in the morning then, right? So that pain is your body telling you that something is wrong. So pain comes after the tightness, right?
Got it.
Okay? So if you're tight right now, you probably have something going on.
And I want to add on to when people always, my patients are like, I wake up. Well, obviously, I see a trend. So maybe there's some wrong sleeping positions you might need to fix. I get a lot of stomach sleepers, okay? Ideally, you're supposed to sleep on your back or your side, okay?
Oh.
If you sleep on your stomach, what happens is you reverse the whole curvature of the spine and all your muscles lock up.
Can you show how you do that? How do you sleep on your stomach?
I do sleep on my stomach. Actually, I sleep like this, and then sometimes in a comfortable position. So this already, I don't know if you want to show them.
Yeah, so as you can see, all this, your lumbar paraspinals are locking up, thoracics, and then your cervical spine. I mean, obviously your neck muscles are so small.
And this is how I sleep. I put it to the side.
And then you turn it to the side. Now you're causing tension on your neck area, so you're getting a double.
No wonder.
Yeah. And for the people who can't sleep on the back or the side, what I advise them is stick a pillow underneath the abdomen, so it keeps it at a neutral state, but still
up a little elevated. Okay, so before we do any type of adjustment, and I know we did before this program, but what type of techniques do you do for the muscles before adjusting? Like, do your clients come in or patients just come in and come cold, or do you guys have a technique that you doctors do, but like to warm up the muscles? I know we did, but just to let the viewers know.
Can we do the grasping and stuff like that?
Yeah. Okay. So initially, when our patients first come in, obviously we do the initial evaluation exam, and pretty much we'll do a pre-assessment test to see exactly which movement aggravates your pain or where you're having lack of range of motion.
Okay.
And then we'll do some orthopedic tests to kind of rule in or rule out if you have any ridiculous symptoms, or to see if it's just a muscle issue.
Okay.
And then from there, we will take a tool called the grasping technique. Okay, pretty much looks like a spork and a spoon and a knife put together. Okay,
but don't do that at home too. Please, right?
And pretty much we'll apply lotion to whatever affected area. So say your left trap is presenting with pain. Okay. We'll place the lotion on here, and we'll take the tool and pretty much break up all that bad tissue.
Do you have a tool?
Is that something that we're going to show our viewers today? Okay. While we're doing that, I just want to there was a comment. HB said hello. So hello, HB. Just wanted to say hey, and my boys here are saying hey, the doctors. So do you want to go ahead and show some of those examples while we're here on the neck area? Sure. Yeah? Okay. So let me get in position. So what would I have to do? As the person laying down, you have to be very relaxed. I guess that would be easier for you guys. Is that correct?
Well, let me do the while you grab the tool, I'll go over some of the assessment that we did before we get there.
Okay. Deal. So while we're waiting, I want to open up those lines of communication for you guys to definitely load up any questions, anything that you guys might want to see on me. Don't get crazy though. Don't get crazy. Because I don't want to be screaming over here. Is this good, doctor? Yeah. Okay. All right.
So typically what we want to do is go through some range of motion stuff testing first to see what's going on, the reasons why you're getting this issue. So I'll do a lot of testing to her left, to her right, and ask her if she's having any pain associated with this. Then we'll go into extension, and then we can go all the way down like this.
I'm flexible, right, doctor?
She is flexible. She does have a little bit of tension as she brings her neck down to her chest, though. So that tells me there's something going on with her neck here and her upper back, and that's how they connect. So what we'll do is we'll go and we'll play pretty much search and destroy with that tissue first. I want to palpate, and she has tightness here and a lot of tightness in here. So what we will do with that bad tissue inside there is want to refinish that tissue using tools. It's like ironing out the kinks on a shirt, pretty much. And this is one of the larger tools, grasping tools. It's called the handlebar. But we do have smaller tools as well. So what we would do is have her go to the side, find those kinks, and then we would go through that tissue like this. And through there.
Ironing out my muscles, huh?
Yes, it is.
Is that what we call this? Okay.
So that's that glue that you feel in the mornings when you wake up. You're like, man, my neck just feels tight. What's going on here? You go through those areas.
Okay.
So this is a larger bar. Then we have a smaller tool here, just like this. This is like a fine tuning
tool.
Oh,
that one's cute.
This is our cute tool, okay? This is like a butter knife at home.
That cute.
Okay. Then we can just go through the area and stuff like that. Now some people are ticklish too. We'll go through the spine and we'll get all the kinks out of the spine there. And we like to do this before we do the chiropractic adjustment, as we want to make sure that all the tissue is loose inside there. Now, if you do have nerve issues, you have spinal trauma or something like that, the skin usually is very sensitive, so it's hard to do this type of technique on there. So we do other type of methods like cupping or stretching or E-stim or something like that to relax those tissues in the skin before we do an alignment or an adjustment.
Okay, that's good. So
I'm looking for those questions.
Yeah, if you guys have any of those concerns, come and visit Dr. Tony Tran or Dr. Stephen Jung here at Integrative Spine and Sports, and they'll let you know the phone number. We'll also put the location below as well as the phone number. So before we move on to the mid-back, do you want to show them an adjustment on the neck part? So if you guys don't like to see certain things, I would advise for you to turn away the camera. It's not going to be painful or anything, right?
Not at all.
Nothing's
Don't turn
happening.
away.
Okay, so then watch. Okay.
Yeah, I'm gonna have you flip over.
Flip over. Okay. So I wouldn't put myself here if it was bad, okay?
So like any patients, like I said, want to get to that soft tissue loosened up first. Then we're looking for any type of rotation or misalignment in the spine here. This is the cervical region, which is also the neck region. The nerves out of this area innervate your hands and upper extremities. So like for her, I'm finding the right side is pretty rotated out there. So I'm gonna realign it. Go through here and there it goes.
Did y'all hear that?
Brand new now.
This ain't even July 4th.
Good, now you gonna flip over?
That was a good one. Wow, okay.
This is a thoracic region, so we're not gonna adjust quite yet, but we will do the same thing. We will go and we'll palpate through the spine here to feel for the spinous processes to see if they're rotated out. I want to save that adjustment for a little bit later.
Yeah.
All right.
Yeah, we're coming up to that. So that's awesome. So I guess you guys heard it. It actually feels good. I feel like a brand new person here on my shoulder. That's crazy. So awesome. Don't be alarmed. It's totally fine. I am fine and have even more energy. So now we're going to go ahead and move on to the mid-back, okay? So the mid-back, I kind of want to ask the same questions. Is there something that causes the mid-back pain? I know we mentioned sleep. I know we mentioned certain exercises. Could those still be the cause for mid-back? I know deadlifts, press, those are things. Go ahead.
The mid-back is like a transitional segment of the body, right? So what happens is the thoracic area doesn't actually move much. It's the neck and your low back. So when you get tightness in any area, it's going to draw the tension down or up. So a lot of people will feel their neck pain go into the shoulders or into the upper back. Or if the low back is tight, it'll go up into the thoracic area too as well. So remember, thoracic spine means mid-back pretty much.
Okay. For those of you guys that are wondering, thoracic means mid-back. So does abdominal core, does all of that also affect that mid-back?
So core is the main foundation of your spine. Obviously, if you're more weight bearing on the front side, I mean, not only your mid-back, but your low back is doing 100,000 times of work that it should be doing. So that's why I always emphasize to my patients core.
Okay.
And one thing I realized with these patients, especially with our athletes, especially CrossFit, I feel as though the reason why they keep having, so we'll treat them and they'll come back and they're like, oh, doc, it's still hurting.
Yeah.
A big part to do with that, if you're constantly still coming back with pain on a frequent basis, there's not only a biomechanical issue going on, but there's muscle imbalance that we need to fix. Okay.
Wow, and you guys do that as well here.
Yes.
Okay.
Yeah, with the corrective care exercises and of course our rehab. But yeah.
They're doing a lot. We're teaching a lot of the stuff that they're doing on the outside of the frontal plane. So most sports, either it's CrossFit or it's just bodybuilding, we do everything in front like this. It's rare that we do anything to the side. So a lot of people that are dominant in the front of the shoulders or of their body, then be stronger there. So when you try to do something in a different direction, things are gonna pull a different way, and you start getting a lot of that the twisting.
Yeah, for sure. And another thing for those of you guys that are watching right now that are at work, posture is very important at your desk. So we tend to, and I'm very guilty, when you're typing, you're just kind of hunched in your comfortable state, but it's not comfortable for your body. There is the natural posture, isn't that correct? That will affect also the back. Is that correct?
Well, most people that are watching this segment right now are probably sitting at their desk. So if you're sitting at your desk, number one, we already have the pressure coming down on top, right?
Yeah.
From gravity. Number two, we're in a sitting position, so our psoases are tight, right?
Yeah.
When your psoases get tight, it causes actually deactivation of the muscles around the core. If you have deactivation around your core, you're going to start having low back pain. You start to have low back pain, and you start getting the extra curve in your low back, and you start having hip pain and mid back pain. So we get that a lot, when people are sitting at the desk, like, oh, my back's starting to hurt because it's weak and deactivated. So we got to make sure we get up and we show them how to do different things outside of sitting.
Everybody get up right now, do a couple little things, walk around a little bit. That's crazy. So maybe we can get some exercises for you guys so when you take your 15-minute break or your 2-minute break, you can kind of get your body in line as well. So let's talk a little bit about the muscles around the mid-back. Is there anything else besides core that we mentioned that also affects the mid-back?
Well, you think mid-back, you think rib cage, right? So the rib cage, it surrounds and protects all your organs. So when you think of the mid area, that's your rib cage. So you start to have a lot of rib cage issues.
Oh no.
Then most likely you're gonna have some mid-back stuff, but that is your mid-back. It starts here and comes all the way to the back next to your spine, right? So when you think of mid-back, think of rib cage.
So everything triggers something, okay? So make sure that if you guys hear your body say something, it's to trigger something else. So do you want to go ahead and show what you were about to show on the spine, which is mid-back, to our viewers so that they can see a little bit more as far as your adjusting?
So I sit right here and I want to show.
Sit. Facing forward? Oh, back. Okay.
Just like this, hug yourself. So one of the first things I want to do is check for rotation in the back. And then on the other side here. So she is tight in thoracic rib cage area, those areas. And what I'll do is I'm going to go and I'm going to palpate through those segments there to see if something's rotated down. Now she has a lot of tension here already. Right about there. This is where most people have the tension at. It's either because our head is going down due to gravity or because we're sitting in a certain position and we're getting that curve there. So this is taking the grunt of that load there. And she does have a lot of stiffness here.
It's because I work too much, doctor.
Your boss watching it?
I think so. That's
hey guys. So we're going to go and we're going to loosen up that bad tissue that is stuck between the vertebrae here. So I'm going to have you lay down on your stomach facing down. Stomach,
okay. How I like to go to sleep. Okay.
Now, if you do get adjusted, make sure that the person that is adjusting you is using a high velocity, low amplitude adjustment, meaning it has to be quicker than it is using strength. Okay. Because if they're using too much force, you can actually cause damage in those areas too. And put your arms inside like this. And breathe in. And out all the way. There it goes. So we got that to audible there. So whoever needs that, go ahead and wave at us.
Yes.
Okay, go ahead.
Give us a couple likes. Man, I'm putting myself out here for you guys. Give me those thumbs up, those likes. Give me some comments for our doctors that are here. We want to hear a little bit more about you guys and what type of concerns that you guys may have. So we just went over the neck part, which you guys call cervical. Is that correct? And then mid-back, which you guys call thoracic. Okay, perfect. So that's two. We're missing one more, which is our lower back. Okay? So now I'm going to ask the same questions. What type of things cause a lower back pain? Now, we mentioned a couple. The sleep, posture. Is there anything else that you've seen?
Okay, so number one, of course, core. Number two, the hip flexors, as Dr. Tran was saying. So as people who are constantly sitting at a desk, or if you're a constant runner, mainly sitting at a desk all day is going to overfire those and cause back pain and deactivate pretty much on the front side. So that is a very, very big contributing factor for low back pain.
Okay.
Along with that, I feel like with a lot of my CrossFit patients too, glute and hamstring activation isn't. They're not ingraining that in their head, because the lack of glute and hamstring activation is going to actually cause your pelvic bone to rock forward, what they call an anterior pelvic tilt. So pretty much, I'm gonna stand up and do it.
You okay?
Yeah, so pretty much, this is how they present.
Don't laugh at them, please. Don't do it in front of me too. Go ahead.
Okay, y'all really watch. Let's get serious. Let's get serious. This is serious. Okay, go.
All right.
Go.
So they'll present like this, right? It looks like I have a nice protruding, but what it is actually my low back is so tight and it's causing this to stick out. Okay. And my pelvic bone is rocking too much forward.
Okay.
Now, if I were to probably activate my glute and hamstrings, I bring my pelvic bone back into a neutral state.
Okay.
Okay. And therefore, now you see my low back is now where it should be.
Wow.
So that's why I always tell my patients, or just patients in general, before you do any deadlifts or squats, make sure you dig your heels into the ground. Okay. And then tighten up those glutes. So therefore, once you do that, you bring your pelvic bone back into it.
Rotating it. Okay. So I'm going to tell you, I am a runner.
Okay.
Yes, I do a lot of squats, quads, all of that good stuff. So that's crazy. Now that makes sense a little bit more on what might cause some lower back pain. Okay, perfect. So we talked about the muscles around it. What might cause that pain? Any other things that you've experienced that triggers any type of lower back pain?
Well, first off, make sure you see your medical provider. If it's a chiropractor or a physician. If there's some type of pain that comes out of nowhere and it's just something that didn't make sense at all, worst headache, the worst back pain you've ever had, and make sure that we roll out the red flags on that. So
okay.
If you wake up with something, you're like, oh, my back is hurting like it never did before, and there's no cause of or reason why it hurts, then make sure you go ahead and get seen as soon as possible.
Okay, perfect. That's awesome to also hear for you guys. If any of you guys are experiencing that, very, very important, just like the doctor said here, to make sure you go see your general doctor and just make sure everything is crystal clear, right? Okay, so Dr. Jung, do you want to show them the examples like Dr. Tony showed on lower back, and then as far as doing whatever your protocol is?
Yes, so all right, I'll come around this side. So pretty much, I'll be upping the lower back paraspinals. Okay, and as you can see, I can feel a little bit of tightness. Now, if I can, let's have you cross your arms, okay? And then I'm gonna have you rotate to the right. Okay. Any pain there?
No.
No, any restriction? Okay.
No.
All right, let's come back this way. Any pain restriction that way?
No.
Okay. Can you bend forward for me? Okay. Come
Good.
back up. All right. Extend for me. Okay, you're doing pretty good, but I do sense some muscle tightness in this area. Let's get you to go face down.
Face down. Okay.
So before we do any lumbar adjustment, okay, we always do what they call the leg length equality test. Okay, so usually sometimes we can identify if there's one leg that is longer or shorter than the others.
Please tell me they're equal.
You're way off, girl.
Uh-oh. Because I walk with a limp.
No, you actually good. Okay, so with that being said, if you can, Marty, let's have you with this side up, facing me.
Facing you. Okay, like this?
Yes.
Okay.
Okay, and then scoot a little closer to the table.
Okay.
Okay, and then keep this bottom leg straight. Bend this top knee here. Okay, and I'm gonna rock you back like this. Turn you into a little pretzel real quick.
Okay, I'm a pretzel, guys. See you later.
Okay, and then pretty much I'm gonna distract like this and rock you over, and then.
Oh yes, I felt that one.
Something happened. Something worked right there.
Yes. Okay. I don't know if you guys got to hear it, but now we're gonna do the other side, right?
Yes.
So you guys now see the frontal or the pretzel here. I don't remember the position, but
the pretzel adjustment.
The pretzel adjustment.
Okay.
Oh, there it is.
I felt it. Yeah.
I like that sound. That was nice. That was nice.
Did you guys hear that? I mean, we have a good mic here, but I don't know if you guys got to hear it. I felt it pretty much trickle all the way down. That was crazy. I feel like taller. That's crazy. Whew. A lot of tension release, all the tension that you probably mentioned that you saw. So that's good. So we now talked about the lumbar, the lower back area. So now a lot of these people here also have their limbs, their shoulders, their, like you said, hip flexors, knees, ankles. There's more to the mix here. It's not just the spine, guys. So who wants to talk a little bit more about those limbs and extremities?
Well, I think a lot of people, first off, when you say sports medicine, they're like, well, what is sports medicine compared to any other type of medicine or type of therapy? Now, when you think of sports, you think of a lot of running, a lot of catching, a lot of throwing. So it's more extremity based. So if you go to a sports chiro, a sports ortho, sports medicine physician, it's mostly can be like your elbows, your hips, your shoulders, and things like that. Awesome. So any type of things that might cause, I mean, that's just a little bit more broad, that might cause pain or tightness. I just mentioned my hip flexors because you just ended up talking about it. That might be the most common one. And I don't know if you guys remember, Trainer Donovan mentioned how important the hips
are for his athletes. So if you guys watched the last Talk to Me Tuesday, if not, make sure you go tune in and watch that show. But a lot of people and athletes have their hip flexors that are tight. What is it, some experience that you find in that, and how?
Well, athletes, they're gifted because they have strong hip flexors. Like we mentioned, iliopsoas and psoas, that's the main hip flexor of the body, along with your quad. Now, when you're that strong in those areas, you can drive up your knees faster. But by doing that, you're using it over and over and over again, right? So we got to make sure we keep those tissues released. If you don't, you're going to start having hip flexor pain. You start having back pain as that psoas attaches to the front of your hip and your back.
Yes, a lot of you guys that might be athletes or are runners or like to work out a lot that are watching, all of this is music to your ears, right? You guys are like, oh, that's me. Oh, that's me. Make sure you load up those questions, and make sure you come in and see Dr. Tony Tran or Dr. Stephen Jung as well. They're great at what they do. If this wall doesn't tell it, I mean, I don't know what else is better than that. And you guys get to see it live, so that way you guys can see how their technique is. And get to hear it too. Doesn't hurt. It feels great, but the sound is like firecrackers out there, just like he said it. So how do you guys evaluate the extremities or those bones? Do you guys want to show on a certain, I don't know, there's so many. I don't know which ones you guys want to target on.
The biggest thing we find here, what we see most often is the shoulder injury. So first off, with any body, we have to make sure we do the testing, right? So we do the muscle testing, neurological testing, a lot of ortho testing. Okay? So like I said, when you think of sports medicine, you think of ortho. So a lot of it is ortho testing. What deficits can we find in these areas? And then how can we treat it to make it better, make a difference?
Yeah.
Right? So everything that we do, we test, pre-test, treat, and test again. Then we'll make sure that you're better before you leave.
That's awesome, because they're going and putting you guys through a thorough testing to make sure that at the end and when you walk out, you are better. That is the goal for them as well as for us as well. We want to make sure that everything is beneficial for you guys that are watching, and making sure that you guys are in good hands. We preach this all the time, and you guys are in good hands. Here we go. So anything else that you guys want to go ahead and tell our viewers as far as the extremity goes, or anything else on your techniques? You did mention those little metal thingies. Is there anything else that you wanted to show our viewers of other techniques? I mean, we don't want to put all your secrets out there, right? Not all the secrets, just a few.
Well, YouTube, everything is out there. I think the most important thing is to get educated about it, to find someone that can diagnose you before you just start doing random things.
Yeah, for sure.
And you see a lot of times after you get treated, it's like, oh wow, that wasn't too bad. That was pretty easy. Well, it's not easy. The diagnostics is the hardest part. That's why we're here, right?
Yeah.
But we do it so much, you make it look easy.
Right.
Do we have any questions for anybody?
Right now, there's no questions right now coming up. I want to ask a question. How often your athletes or even someone that is watching normally come in? You adjust, you make them feel better, they feel tall, everything's good. There's no other reason to come. Should they come like once a month, or just whenever they feel the tightness again? What is your recommendation?
Depends what the injury is. If it's spinal trauma, it's going to take more than per visit. It's going to be a drawn out plan so we can get that nerve irritation out. If it's more of like a sports medicine tissue thing, then it's per a treatment. But most people see this between 3 or 4 times, and they're already released. By your first visit, you're usually about 50 to 75% better.
So if I wake up with a crick in my neck, I come see you, there's a process to it. After you get me better, should the person come back up for follow-up, or they're fine?
Yeah, we always have a follow-up. We'll make sure that you're doing your corrective exercise. You have to make sure that your pain is gone. Sometimes, like I said, tightness is still a symptom of an injury. So even if you got the pain out your first session, your follow-up, you can have tightness there. So you still have those issues. It's just our general public doesn't perceive tightness as an issue.
Right.
So yes, it's good to follow up with us so we can stay on top of everything before we release you.
So there is a protocol for you guys to stay on top of things. But once you guys come in and get treated or just feel better, it's not something they have to come up once a month, every month for the rest of their life. What I
recommend to my patients, I recommend after they've gone back to where they need to be, quote unquote, I recommend at least coming in maybe once a month for maintenance purposes. I mean, the way I preach to my patients, you got to treat your body like a car, like a Rolls Royce, okay? And
Rolls Royce.
Every month you go in, you get an oil change, tires rotated, blah blah. I see some of them patients that rather go do that than rather go see specialists like me and Dr. Tran.
Right.
So like I always tell my patients, treat your body like a Rolls Royce. To put Supreme in there and not unleaded. So what I mean by that is diet. Okay, so whatever you put inside your body is going to reflect how you look on the outside. So as part to follow up what you're saying about patients coming in at least once a month, just for maintenance.
So there is a maintenance portion there, and we are a machine. Our body is a machine, so that's awesome. How diet is really important. I know last week and the week before, Carl spoke about diet and how important it is. So all of this stuff, you guys are hearing it more than once. So make sure that you guys apply it, as well as exercising certain types of exercises. Last week we were with Donovan and Taj, the trainers. They were just saying how important it is, certain exercises. And now the doctors here are saying how important those exercises are to be done right to avoid this type of injury. See, everything's a trickle effect. I'm here to help you guys. So yes, diet, everything's ready. So we can get some more, any questions that you guys may have. While I have the doctors here, any closing statements and or comments that you want to leave the viewers with as far as visiting you guys?
If you want to stay proactive with your body and your health right now, if you have any type of tightness, which you do somewhere, then make sure you go and grab a foam roller, okay, and massage stick, okay, and search maybe on YouTube or somewhere on proper stretches and the way to foam roll certain areas. Because if you can do that, then you can prevent a lot of future injuries, okay? And you can prevent yourself from seeing me. By the time you see me, you're in pain. Right? So do your homework. Foam rolling your muscles is like brushing your teeth. We were raised brushing our teeth, but we weren't raised and educated how to brush our tissues. But we got to because we have one body. Wow. So we got to make sure we maintain it as much as we can.
That's awesome. That's awesome advice. I know, just like you mentioned earlier, to iron it out, you don't want that little spoony thing to be on your muscle. Might as well do a foam roller that you are not already in that pain. So that is awesome advice. And how about you, Dr. Jung? What type of statements do you want to leave our viewers with?
So for all the viewers and people out there, just be mindful of it's the little things that add up to not only the pain and the discomfort, restriction, and whatnot, but just be mindful of, number one, posture. Okay. All right.
Yeah.
Nobody has perfect posture.
Right.
We can program our bodies to get it
so
close to it. Okay. So be mindful of posture, the type of bed, type of pillow that you sleep on. Try not to be too stressed out, because what happens when we get stressed out? We tense up, right?
Yeah.
How many times does that happen throughout a day? Right.
Yeah. So
you can only imagine how much that's putting on your tissues. All right. Another thing, like I said, diet, exercise, water, proper stretching, proper biomechanics. Other than that, like Dr. Tran was saying, get you some type of massage device, foam roller, a massaging stick. What else is there? And just stay proactive. Even if you haven't been to the gym for a while and you want to get back in there, I mean, just take some simple walks. I mean, that's a small stepping stone.
That's great advice. Posture, number one. Number two, stress-free. There we go. So that's pretty good advice. Just really follow that, because that makes a big difference on your muscles, on tensing up, as well as your spine. You heard it from the doctors themselves. I'm just here to help you guys. So make sure that you guys do those things so that you guys don't have to come in. But if you do, you would be in good hands with Integrative Spine and Sports. So I want to mention a couple things before we get off. I want to remind you and thank you guys for participating on Heroic Behavior, which was last month. This month, we're doing something brand new. It is a spa treatment for Mother's Day. So make sure that you like the picture when it goes up, like our page, and share the picture. And you guys get a chance to win a $50 gift certificate for spa. That's going to be this month, all month. Make sure that you guys do that. You guys do it too, because you guys can win.
I'm there.
Yeah, you can get it for your mom, for your wife, for your girlfriend, whoever. Guys, you guys are not out on this one. So make sure that you guys participate. That's called a Heroic Behavior every month from your legal heroes. Don't forget, HCC, Houston Children's Charity event, will be coming up. We'll be loading up that flyer on our Facebook page as well. May 10th, put it on your calendars. Make sure if you haven't liked our page, go like our page. You're going to get any update as far as events or if we have the doctors back on the show, that way you can load them up and make them work really hard. And maybe it's going to be someone else here. Maybe they're going to run the show themselves. They don't need me. They don't need me. So make sure you guys tune into our Facebook. Welcome again, and thank you for loving and sharing our page. Talk to Me Tuesday on a Tuesday. I'm your host, Madi B, and I have today Dr. Tony Tran and Dr. Stephen Jung. Thank you, guys. Have a good one.